Assalamu alaikum. Good morning, everybody. Thank you for the GIS for this kind of invitation. I was given the task to cover the question about comparison between the two available technologies in the market, the radiofrequency ablation, which is the Simplicity by Medtronic, versus the ultrasound ablation, which is the Paradise model. So now let's start with the Simplicity Spiral, which is it's a multi-electrode catheter that has actually 4 points of ablation. So it is a 4 French catheter that is loaded on, that is consistent with 6 French guiding catheter, and it is a rapid exchange delivery method over an 014 wire. The ablation time takes around 60 seconds of a simultaneous energy delivery, and the vessel diameter ranges between 3 to 8 millimeters. And as you see here, actually it has 4 points. If you look at the longitudinal picture on the left side, where the spiral catheter actually adjusts to those vessels in the proper size. And if you look at the cross-sectional image on the right, you will see that those 4 quadrants actually cover the whole circumference of the arteries at different points. If we look at the other model, which is the Paradise catheter, it's a balloon catheter that has a SonoWave 360 degrees transducer with atraumatic tip. And that transducer is covered by a non-compliant balloon. And the point of that is that because of the heat that is generated by the transducer, there is a very unique hydro-cooling system inside that balloon. So this balloon is over the wire compared to the rapid exchange catheter, and it is a 7 French guiding catheter compared to 6 French. Both are being used through a transfemoral approach. And for this one, we have available 6 diameters, starting from 3.5 millimeter balloon all the way to 8 millimeter balloon. And the balloon length is around 10 millimeter, and the catheter length is around 115 centimeter. So this is how it works. So for the Paradise ultrasound renal denervation system, basically you take a selective angiography, and then you go and ablate the main renal artery. So we go on the distal, so we start from the distal, come to the middle, and to the proximal. So they recommend to ablate 2 to 3 points on the way. And as you see here, the balloon should be inflated, and it should occlude the flow, and the ablation time takes only 7 seconds per ablation. Now, let me just review overall the clinical program comparison between the two devices. So if we look at office systolic blood pressure in the clinical programs of Spiral versus the Paradise, we see that in terms of the number of studies and number of patients, there is clearly, we have more number were included, and that was supported by the registry that was initiated by Medtronic, the GSR registry. And you can see that all of them actually showed a benefit or actually a reduction, meaningful reduction in office systolic blood pressure. And if we compare both technologies in the ambulatory blood pressure in those clinical programs, again, we will see that there is actually a consistent reduction in blood pressure in both technologies. Now, if we look at the office systolic blood pressure at 3 years for both technologies, actually we have, again, a consistent, meaningful reduction, but the number of the patients included in the spiral catheter ablation was much more compared to the ultrasound technology. But if we look at the ambulatory blood pressure reduction at 3 years, we only have data from the spiral catheter and that is coming from the ONMED pilot and the GSR defined. That shows also meaningful and persistent reduction in the blood pressure up to 3 years. And in fact, we have multiple studies been published for patients with the spiral catheter up to 10 years that showed reduction. And as you can see here, when we reach up to 8 and 10 years, the reduction is getting a little bit more modest compared to the shorter duration. So these are ongoing, and we will continue to follow that. Now, if we look at the exclusion criteria between the Simplicity versus Paradise, we will see that in the Paradise clinical programs, actually almost a quarter of the patients were screened for renal denervation were excluded, compared to only 3% of those from Medtronic were excluded in those clinical programs. It's important to look at or to understand the anatomy of the renal nerves that were actually seen in this study. It included 6 cadaveric sequential kidneys. 63% of the kidneys had renal arteries that joined distally to the main renal bifurcation. And more than 30% of those cadavers had highly innervated accessory arteries, and that is very important to keep in mind. And actually, that was one of the explanations why HTN-3 failed to show a meaningful result. Now, just to summarize the comparison between the two programs, so Simplicity versus Paradise, so the size of the clinical program for the Simplicity is way bigger, but both were effective. For the Simplicity, we have a one-size-fits vessels ranging between 3 to 8 millimeters. But for the Paradise system, we have 6 different balloon catheter sizes that we need to select for our patients. For the Simplicity, it's a 4 French catheter that goes into 6 French guide, compared to 6 French catheter that goes into 7 French guiding catheter. And I talked about the exclusion criteria between the two programs. Now, I just want to take a quick overview of this clinical trial that was published recently. It's called RadioSound study. It's a single center done in Germany. It's a prospective randomized that compared actually the two modalities. So as you see here, so the screening included office systolic blood pressure more than 160 or diastolic blood pressure more than 90, and the daytime ambulatory blood pressure of systolic blood pressure more than 135. Now, there are 3 arms: the spiral main and branch, and Paradise main. And they looked at the primary endpoint at 3 months, and then they re-evaluated at 6 months and 12 months. What was the result? You see here at 3 months, there was actually, if you compare the Paradise compared to the spiral main, there was a statistically difference between them. But what we are doing now is actually a spiral main and branches. And although numerically it favors the Paradise, but it did not actually reach statistical significance. So the reduction in the ambulatory blood pressure at 3 months was 13 millimeter of mercury compared to 8 millimeter of mercury. As he said, they did not reach statistical significance. But at the end of 2 years follow-up, they were actually all comparable, and there was no statistical difference between the 3 approaches. So what are the areas of debate that we keep in mind in these, between the two technologies? Shorter procedure time. So for the Paradise, we know the ablation will take only 7 seconds per ablation. But if we look at the clinical trial, and for example, for the trial, the procedure actually took almost 84 minutes on average, compared to the ONMED trial that was done for the Simplicity, which took around, on average, 91 minutes. So the difference was not that big in the clinical trials. Now, if we look at the efficient ablation, so we need to understand the distribution of those nerves and those late arriving fibers that in majority of them, they reach actually after the main bifurcation. But when we look at the radiosound clinical trial, we need to keep in mind that that was a single trial. There was no control arm, and there was no, it was not adjudicated for patients who are compliant to their medication use. Now, for the circumferential ablation, that is very well seen in the technology of the Paradise, but also for the spiral catheter. Again, although it's being done at different level, but that spiral catheter actually producing an ablation at those 4 quadrants that is transversing the renal artery. So the ablation is almost similar between the two modalities. Protection of the arterial wall in the Paradise with that hydrocooling system, but we are occluding the blood flow for short duration, of course. But on the other side, the simplicity is non-occlusive catheter, so that is taken in consideration. The ablation depth, so in the Paradise, the ablation goes all the way to 6 millimeters, where it can effectively ablate those nerve endings at that depth. But for the radiofrequency ablation, it actually selectively ablate the fat tissue where the nerves are traveling. Pain and discomfort actually are being controlled by anesthesia. Just 1 minute, please.
1 more minute, please.
Yeah. Thank you. And when we look at fewer failed clinical trials, so HTN3 did not meet the primary endpoint, but on the other side, we have much more data in the simplicity system compared to the Paradise. With that, I finish my presentation. Thank you.